Hi, um, I'm Dr. Christian Garcia. I'm gonna talk about our experience in the first pilot experience that we have done here in the Ministry of Health of Chile about text message for tuberculosis adherence for tuberculosis patients. This is the first mHealth project in our Ministry of Health and in our country, and also is the first one that is nationwide. That's one of the characteristics that we have of this special project. As I told you, I'm Dr. Christian Garcia. I'm a medical doctor. I have postgrad formation in public health, economy, and administration. I'm former National TB Program Director, and actually I am head of the Infectious Disease Department of the Ministry of Health of Chile. And I'm a proud organizer of Viralizando. It's the first and pioneer event of Health 2.0 here in our country. As an introduction about some TB and TB program data of our country, some stats about cell phones in Chile. After that, we're gonna see something about the pilot, the design and the users evaluation, and some conclusion that we had. Here is Chile, my country. It's a country of 17 million people, and we have a important health coverage. 80% of the people has public insurance of health. Approximate 16 has a private one, and the other ones has some other kind of other kinds of insurance. So there's a little proportion of people here in our country without insurance, and that's an important characteristic about our services, health services around our country. TB in Chile have been decreasing. In 1990, the incidence rate was 42 per 100,000 people. In 2011, we have 13.2. We are a low burden country, as you can see here in the map, like Western Europe, North American countries, and here is my country, Chile. But this rate means that we have every year 2,500 new cases every year. That's 7 new cases a day and 5 deaths every week, about 200 deaths per year. This 78% of the patients with TB are adults between 15 and 64 years old. Our TB program is an old one. This year we'll celebrate 40 years of the structure and the formalization in the Ministry of Health of this program. It has a structure with TB teams, tuberculosis teams, with a nurse, a physician, and also a lab professional that are in all the regions of our country. Also, every hospital and every primary care service has 1 or 2 people working in TB. That's very important of the structure, because to make any project you must know where you're going to work, with whom you're going to work, and who's going to provide the service that you're going to provide. The treatment has a universal coverage. It doesn't matter if you had insurance or you don't have insurance. It's also free for everyone. And if you adhere to this this treatment as is recommended, you can almost assure that you will be cured. It will cut the transmission chain, and also the risk of drug resistance will go down. We realized that people who quit the treatment before they finished had gone up from 4% in 2003 to 6.1. That's an important increase, and 90% of them were adults. Talking about cell phones, we have in our country 2.4 million of cell phones, more cell phones than people. This covers or has a penetration of 130%. And in poor socioeconomic groups, like the E that we see here, the penetration was in 2009 83%. Every day there's sent 5.7 million SMS short messages, and 94% of them are read. So what is this MeTA-TB? Meta of mensaje in Spanish, T from text, texto, A, adherencia, and TB, tuberculosis. Also, meta means goal. What is this project? It's a nationwide free SMS system that aims to provide education to TB patients. Its goal is to contribute to the treatment adherence. And who are these clients of this project? Patients with TB diagnosed receiving treatment in the first semester of 2011. Who will provide this service and will make the tell people to get in this service? Would be all these professional technicians working in primary care, hospitals, nurses, and so we needed to communicate to them what it was this MeTA-TB, what we wanted to do and how it works. So we made posters like this one that you see here. We made some flyers for the pages, and also we made direct communication to all the TB teams by mail. In all TB courses around our country, we talked about this special project. So it was a strategy of internal marketing to people who were going to offer this service. Well, the design is after the active search of patients, the smear analysis, and after that the diagnosis of tuberculosis. Patients will go into the treatment. The treatment is a treatment of 24 weeks or 6 months. And what we did, we designed in this part that they had to enter and send a special command, TBC. That's how we call the tuberculosis, TBC in Spanish, and the number of weeks that you were in treatment. If you are just beginning your treatment, you send TBC and 1. If you were in the 5th week of treatment, TBC and 5. Why was that? Because we designed special and individualization. We designed these special messages for each week, specially designed, because it's different the things that you're living in the 2nd week than the things that you're living and experiencing in the 10th week. So here is an example. Well, after the server sent two SMS every Tuesday and Thursday. Here's an example. Do not miss an appointment to take your TB pills. Even though you feel healthy, the microbe gets completely killed after 6 months of treatment. Another one. What could happen if you don't complete treatment? Your family and loved ones could be infected by even more powerful microbes. We wanted that patients understand why they need to go, to understand the importance of getting the treatment and finishing the treatment. Not only to tell them, remember going to the doctor, or remember taking your pills. It was important for us to make sense for people why it's important that. We had the alternative to cancel the service with this command, and after we finished this project, we developed a poll, a telephonic poll. 922 people entered this project. More than 1,000 tried to enter. 90% did it, and 79% of all that tried did it at the first attempt. So it was easy, very easy for them to just send a message. This difference is because of some of the patients needed 1, 2, 3, 4 or more messages to enter. They miss a letter or something. But this is interesting. After we finished the period of our project, more than 300 people tried to enter. The total SMS sent was 25,500 SMS in total. The result of this telephonic poll, we were able to contact 400 people, and 217 answered our questions. Here's our first surprise. What happened? We asked the first question: did you receive TB treatment during last year? 31% said yes, and 69% were people without TB. That's interesting. What happened there? People who, what we thought didn't need this information, were interested in getting this information. So it's something to think about. Why? We asked them, did you read the messages. 92% of people with TB and 98% of people without TB read them. Similar about what we found in the literature, about 94% that people read SMS. We asked them also, do you think the SMS were useful for you? Even though people didn't have TB, they found the information useful. And 95% also of TB patients did find it also useful. Moreover, did the SMS help you to stay in treatment? We asked TB patients, and 84% of them answered yes. We feel that messages help us to finish and to stay in our treatment. Here the satisfaction, satisfied, very satisfied and totally satisfied. 82 and 84% of people with and without TB said that they were satisfied or more. This one I like it the most. Is would you recommend this system, MeTA-TB, to someone in your same situation? And 93% of people with TB in treatment said yes, and 99% of people without. So, as conclusions of this first project, this exploratory project, is the user's perception of this SMS, of this system, as it is useful, that they will recommend it. SMS might help people in treatment of tuberculosis to stay in treatment. They seem attracted to healthcare users also. If not, why people without TB would be interested in getting? Maybe because this is a free, remember, a free messages system. That's one point. Could be a good strategy also for adult and youth. It's important to focus. If we need a special group to get information, we need to make a special design to focus and to select well people that are going to enter the experience. The win-lose. We have a simple way to enter for the inscription, but we have problems with the data. We don't have electronic records, so it was difficult to get data about our patients. So if you want to win in simplicity, maybe you're gonna lose something. In this case, it was data. We must be aware of structure before building up, and knowing, in this case, the structure of the TB program, a traditional program, is very important because it's a culture of work. So it was easier for us to communicate to our teams and to make them offer this service. What this SMS technology and mobile technology can help us is to be very massive, but also personalized, as we did. If you are in your first week, or in the second, in the third, you're gonna receive the message that is important for that week, because the experience is different in the different weeks of treatment. And finally, future impact analysis should be developed. And this is a major topic in mHealth project. We must scale and get forward into future impact. What is really working, and what is sometimes is more important, what is not working. So this is a vital point for the future of mHealth. And that's it. Hope you enjoyed. Thank you very much. Gracias.